Over the past few years, the healthcare landscape in South Africa has undergone substantial changes due to the evolving needs of our people. The increasing burden of disease, shortage of healthcare professionals, and struggling infrastructure are just some of the factors that are stretching our healthcare services to the limit. In an effort to alleviate these challenges and improve access to quality, cost-effective healthcare to all South Africans, the government has begun a process of healthcare reform that will culminate in the introduction of a national health insurance scheme. For this vision to become a success, it is critical for all stakeholders to take a collaborative approach.
South Africa's healthcare industry finds itself at a critical juncture, which is bound to change the way healthcare services will be rendered. The government has now begun its process of healthcare reform, which is designed to ensure broader access to quality healthcare services to all our people. We believe this is an important reform, one which can be successful if all stakeholders take a collaborative approach.
The Hospital Association of South Africa, or HASA, which represents over 90% of all private hospitals in the country, believes it has an important role to play in helping the government achieve its vision of improving healthcare delivery to the citizens of this country. So, to ensure that the private hospital industry continues to make a positive and meaningful contribution to healthcare delivery in South Africa, HASA began the process of restructuring, transforming and realigning the private hospital industry's vision and role to be more in sync with the changing healthcare landscape. There was a need to make sure that HASA's new role really reflected the future vision of healthcare in this country, and that the association was optimally structured and able to respond to industry developments and needs in the most effective way. As part of a restructuring exercise, the board of HASA got together and reassessed their purpose. They really took a good look at what should be focused on, and the board arrived at the following conclusions. Going forward, HASA's purpose will be to lead the private hospital industry. This means HASA will engage proactively and build good relationships with all stakeholders, represent the interests of its members in matters pertaining to the healthcare industry, and serve the interests of patients by promoting quality care and patient safety. HASA's focus areas going forward include engaging proactively with all stakeholders, providing credible and quality research, building quality relationships with stakeholders, and carrying out these functions within legal parameters. After completing this exercise, HASA took a good, hard look at its values and what it stands for. The core values identified are the industry's North Star, and everything it does or doesn't do will be guided by these. Acting responsibly at all times. Acting with integrity and dignity towards patients and stakeholders. Engaging with various parties for the greater good of healthcare, and be caring in its approach.
Our restructuring process also meant repositioning our brand to one that encompasses HASA's realigned values, purpose, and commitment. And this is what we came up with. The new logo is centered on the letter H, which is widely recognized as the universal symbol of hospitals. This ties in with the core of what we do, which is restoring the health and vitality of our people. The hand in the center symbolizes the value of our patients and the care we deliver to them. We also developed a new payoff line, advancing healthcare. This speaks of our unwavering commitment to providing quality healthcare regardless of the challenges that may come our way. We believe that the new brand fully represents HASA's realigned strategy.
An efficient system is one in which all functions and stakeholders are connected and work together for the greater good. The same is true of our healthcare system. In a country with such a wide diversity of healthcare needs and an escalating burden of disease, it's essential for the public and private healthcare sectors to reconnect and work together for the well-being of all South Africans. As HASA members, we play a crucial role in providing healthcare services in South Africa. We also desire to extend quality healthcare to a greater number of South Africans. This means that it's imperative to engage proactively and progressively with various stakeholders in order to share and implement our collective ideas. By working together, we can create an accessible, well-functioning and sustainable system. This, we believe, is how a connected system can benefit us all.
Engagement is the key to unlocking the full value of our healthcare sector. By getting all stakeholders to share their knowledge and expertise, we can positively reform our healthcare services into a more efficient system that serves more South Africans with excellence. A reformed system does need to be sustainable, and to achieve this, we believe that different views need to be taken into consideration. This means open dialogue and ensuring, above all, that patients come first. Patients deserve to have a choice when it comes to their healthcare needs. So if all stakeholders are given the opportunity to play their part in both shaping and bringing about quality access to healthcare, we can create a much healthier nation.
We are confident that by partnering with the public health sector, as well as other healthcare stakeholders, we can build a lasting, quality healthcare system that will benefit all South Africans for years to come. And by working together, there's so much more we can achieve, and most importantly, learn from each other.
Guided by our values, we undertake to have the courage to stand up for what we believe in, and in the same vein, have the humility to listen and consider the views of others.